Yeah, my name is Hoyne. I'm a consultant psychiatrist and professor of psychiatry and editor of Global Psychiatry Archives. And we would like to report of a recent paper. And this is from the team of Professor Carr from Lucknow University in India. And the first author is Vidya. And they report about a systematic review on transcranial magnetic stimulation, TMS, well, I mentioned this, and in a specific sample of late life depression. They've done a systematic assessment of the literature using Scopus, PubMed, and Ovid. Initially, I found 490 papers. Plenty of them were not related to the topic. Some were excluded because they were duplicate or were unavailable or other in Chinese, which weren't accessible to the authors. Finally, they had 26 articles, which included patient articles of RCT, randomized clinical trials. And I don't want to go into these details. If you want to read the paper, please check www.globalpsychiatry.co.uk. There you can download the full article. What they found is that they have 8 randomized clinical trials, which some of them showed some advantage in the depression response compared to the control group. However, in some cases, the improvement was in both groups, and there wasn't any significant difference. The difficult part to compare all these studies is that they all use slightly different ways of comparing the response, as well as they had differences in the activation with TMS, transcranial magnetic stimulation. So in total, the literature is incomplete, and the frustration about that is that TMS is quite often used in the elderly. Some people say it's an intervention which has little side effects. However, one wonders why this can be used so much if the literature is not totally convincing, and there is no simple way of comparing different studies and different activation designs. So I think further research is needed. I think there's some minor evidence, less convincing evidence that TMS is useful, but it shouldn't be excluded, and it may depend on the options you still have with the patient concerning with the medication and the access you have with TMS, whether you can do this properly. And here certainly needs to be said that there needs to be a good supervision from the clinician to use TMS in treatment-resistant patients. Thanks for your interest, and if you want to listen to more of this, please subscribe to our channel, Global Psychiatry Archives, and if you like it, please let us know. Thank you.